I'm Sherry. I've worked for MultiCare for 18 years, and I work in the labor and delivery unit. I've been working labor and delivery for about 7 of those last 18 years. So our day starts off with the beginning of shift huddle. It's where the previous shift comes together with the oncoming shift. They get together, they talk about any issues that may have come up, how to resolve them, and how to make the next shift better. So it's really a great platform for the nurses to kind of vocalize any concerns, to problem solve as a team, and to start your shift off on a positive note with one another. After the huddle is completed, the charge nurse gives everyone their assignments. We have a very diverse population of patients, so anything from low-risk labor to high-risk patients. You're constantly challenged. We round on our patients, we manage their labor, assist with pain management. So our focus is on quality, family-centered care. We want to provide a safe, supportive, and compassionate environment for our patients while managing their labor and assisting with any questions that may come up for them in labor, and not just our patients, but their families as well. So we have anything from low-risk labor. We're a state-designated Level IV NICU, so we see high-risk patients as well. We're the largest NICU in the South Sound, so we have patients we take care of with diseases of pregnancy, issues with preterm labor, so a very diverse group of patients. We really have a commitment to teamwork. You always have someone that's there to help you, and the collaboration with your peers is really essential to being successful. We have a flow when we come on. There are nurses who've worked together who have best friends that they've worked with for years on the unit. So we also have a commitment to clinical excellence, exercising within our scope, and exercising with what the current standard of care for labor and delivery is. We work cohesively with our postpartum department, our Women Newborn Center. It's really a care line service. So between women newborn, labor and delivery, and our NICU, we're a very cohesive group. Anytime you have any issues with concern for a baby, you have NICU ready and available to answer questions. They come talk to parents for us, to answer questions to worried moms and dads who have concerns about a preterm delivery, or even with the postpartum course. There are some nights where we're really busy and we have a postpartum nurse who will float down to labor and delivery and help take care of our postpartum group. So we're really a great team, all of us. Epic is awesome. You can be at the bedside with your patient and chart as you're taking care of your patient. So at the end of your shift, you don't have hours of charting to catch up on. We talk about back in the day when we had flow sheet charting, and we'd sit at the desk and have to write a narrative on taking care of our patients. It's so much simpler, and we're able to access a patient's record, look at their entire prenatal history, their visits with their physician, any issues that the patient may have. So it just enhances that quality patient care. Well, I've worked for MultiCare for 18 years, and MultiCare, when I started working, I was 19, I was an LPN. MultiCare has a tuition reimbursement option, so it helped me pay for school to complete my degree for registered nurse. Also, there's a continuing education program. I've used money for my education to become certified in inpatient OB, and also obtained a subspecialty certification in fetal monitoring. The flexibility of hours, we have a variety of 8-hour shifts, 12-hour shifts, and there are some girls who work 12-hour shifts and they get them all done and then they have a week off. So flexibility. There's a professional excellence program. There's also a continuing education fund for employees, so it helps to pay for conferences you may want to attend, any textbooks you may want to purchase. So there's a certain allotment per year that you have at your disposal for continuing education.